Hello, everyone, and welcome to the latest edition of the Radiology Advances podcast. Today, we're delving into a recent piece of original research published in Radiology Advances. It's titled, Quantifying Changes in Steatotic Liver Disease After Bariatric Surgery Using Ultrasound-Derived Fat Fraction.
Right. This study by Nanda Thimmappa, Gaballah, Yasin Labyed, and colleagues from the University of Missouri, MD Anderson Cancer Center in Houston, Texas, and Siemens Healthineers, focuses on a serious challenge. For so many patients with severe obesity, hepatic steatosis is a widespread and serious challenge. While bariatric surgery is an increasingly popular intervention, accurately monitoring changes in liver fat after these procedures is still an issue. To be clear, a non-invasive, quantitative, and available tool is missing.
That's precisely the core problem this study aims to address. Right now, the reference standard for the assessment of hepatic steatosis is the biopsy, which can, for obvious reasons, certainly not be performed in the daily routine. On the non-invasive side, MRI proton density fat fraction, or MRI-PDFF, is considered the reference. It provides highly accurate quantitative fat fraction measurements with excellent correlation to histology. However, its significant cost and limited accessibility mean it's just not practical for widespread or frequent longitudinal follow-up, and that leaves a clear gap in how we track these patients over time.
Okay, got it. So if biopsy is too invasive and MRI-PDFF too costly for routine use, what are clinicians currently relying on for these patients? And, why is that falling short in the post-bariatric surgery landscape?
That question highlights the challenge. Many centers still rely on conventional qualitative ultrasound. While it's widely available and affordable, its major drawback is its subjective nature. It's highly dependent on the operator's experience and judgment.
Right, very operator dependent and only qualitative information. You don't get a precise quantitative measurement. And that number is what you need to track subtle changes over time.
So this is where quantitative ultrasound techniques come into play. Can you break down what technique the authors of the study used?
Absolutely. They used the ultrasound-derived fat fraction, UDFF. This metric bases on the measurement of the attenuation coefficient, AC, and the backscatter coefficient, BSC, which have individually shown strong positive correlation with histology and MRI measurements. But, and here comes the twist, UDFF gives you the liver fat in percent, just like MRI-PDFF, but at much greater accessibility and potential for point-of-care usage. Recent studies have demonstrated a great diagnostic accuracy of UDFF for grading hepatic steatosis compared to MRI-PDFF.
Okay, and what was the hypothesis of the study?
Previous studies have already elucidated the fact that hepatic steatosis decreases in obese patients after bariatric surgery. The authors hypothesized that UDFF measurement was significantly lower 6 months after surgery compared to preoperative values.
And it was a single-center, prospective, and longitudinal trial.
Initially, 24 adults being scheduled for bariatric surgery were enrolled, and 17 completed the entire study protocol, which was scheduled as follows. The preoperative assessments included UDFF measurements, serum metabolic tests, liver function tests, and evaluations of demographic and anthropometric data. After the mandatory liquid diet prior to surgery, which is standard clinical practice, these assessments were repeated immediately before the surgery. Finally, tests were run at 6 months post-surgery.
A lot of data. And for the ultrasound component, they utilized a high-end Siemens Healthineers Acusen Sequoia system with a specialized transducer operated by experienced sonographers. To ensure consistency and accuracy, they followed a standardized protocol, positioning a 3 by 3 centimeter region of interest about 1.5 centimeters below the liver capsule.
Right, and they took 5 UDFF measurements and recorded the median value during shallow breath holds to minimize motion artifact. This level of standardization is, key for reliable quantitative data.
Speaking quantitatively, we do not want to get too much into statistics on the podcast, but give me a brief summary on their statistical methods.
They employed standard paired t-tests to compare changes between time points and Pearson correlation to assess relationships between variables. A p-value of less than 0.05 was considered statistically significant.
Okay, now for the compelling part, what did they actually find? What were the key results from this study?
Let's start with the liver fat measurements themselves. They observed a significant decrease in mean UDFF from 20.4% pre-liquid diet down to 11.08% at 6 months post-surgery. And there were no significant changes between pre- and post-liquid diet.
That's a significant reduction of 9.32 percentage points over the 6 months interval. Okay, so the significant improvement in liver fat directly tracks with the surgery. And beyond liver fat, what about the more visible physical changes? Do you want me to give a few details?
Go ahead.
As you expect, weight, BMI, and waist circumference was significantly lower 6 months post-surgery. In detail, weight decreased from 128.60 to 98.29 kilograms. BMI decreased from 46.27 to 35.51 kilograms per meter squared, and waist circumference decreased from 130.29 to 111.98 centimeters. All statistical evaluations yielded a p-value of less than 0.001.
And again, no change for the liquid diet prior to surgery.
Not so fast. There was a slight but significant reduction of the BMI in the post-liquid assessment to 44.73, coming from 46.27.
They also observed a robust positive correlation between the reduction in UDFF and the reduction in BMI, suggesting that as patients experience significant weight loss, their liver fat, as measured by UDFF, decreases proportionally. However, it's worth noting there was no significant correlation between changes in UDFF and changes in waist circumference.
Okay, let us leave the imaging aside for a moment as they also ran a few laboratory tests. They looked at liver function and checked glucose and potassium levels, among other parameters. What are the most important results to that regard?
There were some interesting shifts, though maybe not all were as dramatic as the fat reduction. Among the standard liver function tests, only alkaline phosphatase, or ALP, showed a significant increase. It went from a mean of about 96 UL pre-diet to roughly a 104 UL post-surgery, with p-value of 0.04.
Is that increase a concern?
Not typically. This is actually common, though, usually transient finding after bariatric surgery. It's often attributed to rapid bone remodeling during weight loss and not usually indicative of liver injury. Crucially, there were no significant changes in alanine aminotransferase, ALT, or aspartate aminotransferase, AST, which are more direct markers of hepatocellular injury.
Okay, so lab-wise liver health seemed stable. Let's get back to imaging. From your point of view, is there anything relevant to add?
Yeah, I got one more point. They measured skin-to-liver capsule thickness as another parameter for hepatic steatosis as well, and found concordant results to the UDFF, meaning skin-to-liver capsule thickness decreased significantly from pre-liquid diet to the 6-month post-surgery time point.
So putting this all together, what do these compelling results mean for clinical practice? It sounds like UDFF could really make a difference.
These findings strongly suggest that it could have potential for addressing a significant clinical need for non-invasive quantitative monitoring of hepatic steatosis after bariatric surgery. Its advantages are clear. It's portable, provides objective numerical data, is suitable for point-of-care settings, and is showing repeatability and reproducibility.
Given that MRI-PDFF is considered the non-invasive reference standard, how do these UDFF findings compare to what's been reported in other studies using MRI-PDFF post-bariatric surgery? Does the 11% post-surgery UDFF align with what has been shown with MRI-PDFF?
That's an important comparison, and it's where we see some nuance. Other research reported a mean MRI-PDFF reduction from about 18% at baseline to 4.9% at 6 to 10 months post-surgery. The study we are discussing, by Thimmappa and colleagues,
yielded a reduction from about 20% to 11% at the 6 months time point. However, the study on MRI-PDFF contained longer follow-ups, and comparing the values is challenging. Still, UDFF might be susceptible to overestimating hepatic steatosis due to artifacts from the abdominal wall.
This really highlights the need for direct comparative studies head-to-head. The missing comparison of UDFF and MRI-PDFF is definitely a limitation.
It is definitely a point to be addressed.
With that call to more invigorating research, we're coming to a close of today's Radiology Advances podcast. Thanks to Nanda Thimmappa and colleagues for their work published in Radiology Advances. If you found this episode informative or have any other feedback, please rate, review, and subscribe. It helps more people discover the podcast and supports the broader conversation around innovation in imaging. You can read the full article and explore more great content on the journal website. This episode was generated with the help of AI, but all content was reviewed and verified by editor Dr. Luca Salhofer from University Hospital Essen, Germany, for accuracy. Thanks for joining us.